Let's start with what you're doing. I understand you run a hospital in the Equatorial State. What are you doing there exactly?
Well, it's not a complete hospital yet. We run a facility. It's a clinic at this time, but we're in the process of building the hospital. And it's basically in a rural area to try to help some of the people who have a very minimal access to medical care in South Sudan.
Okay, what's needed most to support South Sudan's health infrastructure as far as you know?
You know, the problem with South Sudan is that the needs are very vast. And so to start with the healthcare, I think what we need to do is first actually address the basic needs, which is just basic primary care in the rural areas to address the issues of malaria, malnutrition, diarrhea, asthma, and all those things that are just killing people when they shouldn't be. And that's what we're doing. We're trying to address the primary basic needs of the people in the rural areas. And then after that, we move on to the other secondary needs of the secondary health needs for the people.
So which category of people would you say are impacted most by health issues and why? Is it the young, the elderly people, or does this really depend on the demographics?
I think it's mostly women and children. And the fact is that children are more vulnerable to diseases, especially dehydration. You know, when they have diarrhea, they are more likely to die from it. And these are things that are very easy to treat. So one of our major project right now is we're trying to put up a pediatric hospital in the area where our clinic is in order to address the basic needs of the children first. Because the children are leaders of tomorrow, and without them, the country is really doomed. So we have to take care of that. And then the other thing is also women. South Sudan has one of the highest maternal mortality rate, and we're trying to address that issue by providing them with prenatal care and prenatal vitamins and all that that's needed to produce a healthy baby.
You know, a lot of people would like probably just to hear what kind of, support you're giving. How do you rally the South Sudanese diaspora and other people, because you're based here in the U.S., to help support maybe in terms of medication, equipment? What is being done to assist those hospitals?
It's one of my second jobs that I don't get paid for, so I do it out of my heart, and I have a lot of support from my family and friends, and the generosity of the American people, because they've been helping us in terms of raising funds to be able to pay for the incentives for the employees. We have 25 employees at the facility, and they need to be paid to be able to care for the services. But we also have introduced what we call a sustainable system, where the patients have to contribute something small. It's not necessarily 100% free, because a lot of the time people think they don't have anything, but they have a chicken running around that is actually a resource, or they have some G-nuts, or they have some maize that they can actually sell and be able to pay for a medicine that will cure a child that would have actually died. So we're trying to teach them how to be able to take care of themselves, just in case, like in the COVID-19 pandemic, resources dry up.
Doctor, when you talk about resources and helping people understand, maybe there's some basic things you could tell our viewers about just caring about the nutritional needs that may help alleviate some of these, diseases.
Yes, I think the basic need for health is really nutrition. So you have to teach the people to eat right, to be able to grow enough crops to sustain their health, and that is partly a part of the government. Actually, I think the government of South Sudan should be focusing on that to make sure that there is instability in the areas where people cultivate their own crops and be able to feed their families. And then comes in the health, because without health you really can't grow crops if you're not healthy. So that's where we come in. We say you need to be able to grow enough crops to sustain yourself and your family, and we will help you with health needs if that arises.